Monday. It's time for Ask Melissa Almost Anything, where we talk about your life and your body, where we believe your health care is your responsibility, where how you spend your healthcare dollars is also your choice, but most importantly, where we believe pain is not normal. I'm your host, Melissa Meiste with Nephew Physical Therapy. Today, we're talking rotator cuff, not roto cup, not rotator cup, but rotator cuff. See, the rotator cuff is a very, very, very important muscle group of the shoulder. It is made up of four muscles and it creates a cuff right here around the top of the joint. It is also one of the most common aches and pains that we see in our office due to impingement, and that fancy term for pinching. And it is also probably one of the longest rehabs that we do with any client after surgery. You see, in my experience, and I've been a physical therapist for over 20 years now, what I have noticed is the most common people that are getting rotator cuff surgeries, non-traumatic reasons, okay? They didn't fall out of a tree or get hit by a bus, slip on ice in the parking lot. Those are common things that we see for the rotator cuff. But common repetitive injury, repetitive pain over a long period of time, I'm telling you, it's the men over 45. So if you are a man over 45 and your shoulder hurts, you are at risk for rotator cuff surgery. You see, the rotator cuff, as I said, is made up of four muscles, and it goes around the top. These muscles then are responsible for rotation, which is this motion, which is behind the back, throwing, changing light bulbs. Oh, let's see, what else, right? All of these things that require that shoulder to move everywhere. And shoulder impingement shows up where it pinches, okay? Usually you can have full motion, but you don't want to. It's not for lack of strength. It's due to pain that is preventing that muscle from adequately contracting. So when it comes to that rotator cuff, again, it is very, very common for us to see men suffer with this. The other thing I'm going to say, and again, I'm married to one, so I think I'm allowed to say it, and I'm a daughter of one, and I have many friends, male friends. You guys are notorious for living with it, okay? And if you haven't already picked up on it, we believe pain is not normal. And so what happens is we see men live with it much longer than maybe women would, but wait for it, ask for help. And so when it comes to the men in our lives, women, sometimes we have to encourage them to get some help. They're also, I hate to say it, the least patient in getting results. So when we talk about the rotator cuff, again, prevention above all else is key. And so those situations is where we prefer to address the relationship between the chest and the shoulder blades in regards to making sure that they're balanced. That, of course, connects to posture. The rotator cuff is most greatly affected when we have horrible posture, which we've talked about this many times, is sitting at our computer too much, sitting on recliners, riding in the truck, doing things that over time gravity pulls us down. And what we need is we need that balance for motion here. Let me show you here a second when we know we're having impingement or problems with the shoulder, and let me show you then how that relates to posture. So often when I'm evaluating and working with a client who then comes into our office with pain, inflammation, impingement of the shoulder, we talk about the relationship between posture and shoulder motion. So when I'm upright, okay, my shoulders are pulled back, which means I have flexibility in chest and strength between my shoulder blades. I have nice, almost 180-degree motion, okay? Moves well, doesn't pinch, plenty of motion. Watch what happens to my shoulder motion when I slouch. And but this posture isn't so uncommon, friends. So I'm here, look at where it stops. It stops much faster than in this position. So the ability of your mid-back, your thoracic spine to extend and go upright is directly related to your ability to reach overhead. So yes, posture is important. But as I've said many times, posture is more than sitting up straight. You have to have flexibility of the chest, and you have to have strength in the shoulders, shoulder blade muscles, which is not the rotator cuff. While we will strengthen and engage the rotator cuff in physical therapy, it is not all that we work on. So from a really simple perspective on the prevention side, and we'll get to the post-surgical side here in just a minute, from the prevention side, my top go-to exercises are chest stretching, thoracic extension, rotator cuff strengthening and external rotation, and shoulder blade squeezes, also known as scapular retraction. So let's start out with chest stretching and thoracic extension. Keep in mind, all this advice is given without a face-to-face evaluation and assessment. So these are do at your own risk, all the legal rumble jumbo that says we're not liable, you know all the things. So first exercise that we start almost every single shoulder client on, again, this isn't a post-surgical situation, as we're talking foam roller. This is the scenario, this is the exercise where you're laying on this from head to tail. All right? Setting my booty down here, my head is here, my knees are bent, and I am laying back, allowing gravity to open me up. What it does is two things. It stretches out the chest slowly and gradually because it's the distance from the foam roller to the floor that I'm opening up my chest. That is slow and prolonged over time, which is why it is most likely recommended that you do this particular exercise for 4 to 5 minutes. The other benefit of this exercise is what we call thoracic extension. Thoracic extension is the positive motion that fights being a humpback. You've seen individuals walking around Myers, they couldn't stand up straight if they wanted to, they're rounded, they're forward. And so what we actually need is to provide mobility, this is about motion, between the shoulder blades and kind of emphasizing that opening up posture. And so laying on the foam roller allows for that to happen. So first of all, again, we have chest stretching with thoracic extension. The next thing we want to do, now that we've opened those things up, is we need to do shoulder external rotation. I've mentioned this a couple of times on these videos, but I will revisit it again. Doing shoulder external rotation is this motion, okay? Functionally, it is reaching behind your head, scratching your back, and also throwing a ball, all those variety of motions. The best way to start out strengthening, maybe it's a small weight, is the arm is at the side, envision me laying on my side, and I'm doing this motion. I am pivoting and spinning through the humerus, through the upper arm, that is stationary and pinned into my side. So I'm spinning around this axis. So it is doing this motion. The other thing that is happening is, I don't know if you can see that, is my shoulder blade is actually moving towards my spine, okay? This motion here, if done correctly, you'll feel tightness right around here, which is the referral pattern of the rotator cuff. If you're working the rotator cuff, or if you have an injury to it, you'll often feel that right down here, kind of right on the mid upper arm. So you want to have the shoulder rotating, you want to have the shoulder blade moving, okay? That nice motion, which again is a good follow-up to that chest stretching out. Recommendations for that? Fatigue is probably my favorite thing. I would do both sides. We like to use timers around here because who wants to count? So if you could, this is a 1 pound weight, friends. We're not talking about something heavy. 1 or 2 pound weight, a soup can. Do it for 1 minute right, 1 minute left, 1 minute right, 1 minute left, 1 minute right, 1 minute left. Doing that back and forth, or do about 6 minutes of exercise, bringing that final exercise to fatigue. The precautions are no neck pain, no hiking here, no straining. So you want to isolate that through there, quality motion. The last exercise that we like to do when we're preventing or managing shoulder issues, and again, I'm giving you just my top 3 things because there's a wide variety of exercises that we will do with a client. It does depend on your individual ability. It depends on how well your muscles actually fire and contract in the right order. So we call that muscle firing patterns. We're looking to make sure the right muscle engages at the right time. It's not something most people realize, that there is a sequence of events that determine what muscle is being used correctly and what muscle shouldn't be used in that scenario. We often see this when we're activating the glutes, because if the glutes are weak, the back will want to do the work in compensation, and that's not what we're looking for. And so that's where, if you in fact are going to physical therapy, which is what we do here at Nephew Physical Therapy, you want to be somewhere where you have the skilled eye of a physical therapist or a skilled physical therapy assistant who is watching you complete these tasks. As I've mentioned before, many of my friends around the country are asking, how do I find a good physical therapist? Because they don't live in West Michigan. And they'd love to come see us here. Obviously, it's not feasible by airplane. So for regular visits. And so what I've encouraged them, this is one of those tips that says you should be working with somebody who is watching you do the exercises. If they're sending you off to go do this, sending you off to go do that on that machine, they're not making sure that that muscle firing pattern and sequence is working correctly. And so we need to see that happen. All right, so the last exercise, again, when we're talking about prevention of shoulder pain, or some of the things that we do when we're rehabbing a shoulder with shoulder impingement, a shoulder sprain, shoulder pain. We affectionately call this the $5 footlong. Now, if you don't watch TV and you don't know what a Subway commercial is, I'm not sure that I can help you, but as I say $5 footlong, many of you have this jingle now spinning around in your head. Because I know I do, I will spare you all by not singing it. Okay, so this is where we're going to take an exercise band. We have many of these in the office. We figure out what tension you need, and we cut it so that it's about shoulder width apart, just slightly less. As the same motion as we demonstrated with the isolated shoulder external rotation, we're now doing a combination motion here of shoulder external rotation, just this motion, and shoulder blade squeezes, okay? So what I'm doing here is I'm nice and upright. I'm going to take and separate and pull. As I do this exercise, I am feeling it in my upper arm, and I have to mentally tell my body to make sure that my shoulder blades are trying to touch. Many of the exercises that we're working on with individuals really is kind of a 50-50 scenario, meaning 50% body power, 50% mental power. As we're trying to retrain our body to work correctly, we need to think very, very systematically. We need to pay attention to how our body is responding to this motion. And as in many scenarios, we're just not coordinated enough to figure out what we need to do. So the $5 footlong, notice how, again, if you got that commercial in your head, you know what I'm talking about. So I'm pulling through here. In a side motion, we're going to see those arms separate. I'm not shrugging. I'm not rounded and forward. I'm upright, slightly pulled back. And I'm engaging between the shoulder blades. I wouldn't want to do this exercise with my neck turned because you will strain your neck. So you want to be nice and upright, an ideal posture, and you're going to reinforce that. Again, we're using that scenario. We're doing 1 or 2 minutes of continuous exercise with pauses in between 2 or 3 sets. That's where you start to work on those things. So a couple of things that you can try if you're noticing some stuff in your shoulder. If it's super painful, these things may not go very well. And that's where manual hands-on therapy comes into play. Again, if you're joining us, feel free to put your comments in the chat. I'd be happy to answer them. Otherwise, we will now be transitioning into the aftercare. We've been talking through some of the tips, if you're just joining us, some of our favorite exercises, some of the things we start out with in physical therapy, some of the things that you should be looking for if you are in fact looking for a physical therapist and do not live in West Michigan and you can't come to the awesome team at Nephew Physical Therapy. Let's talk about that rotator cuff surgery. Here's the thing about rotator cuff surgery. It is probably one of the biggest commitments you will make in regards to recovery. It is traditionally a minimum of 3 months of therapy. And if the surgeon doesn't tell you, although many people say that that's what their surgeon tells them, it will take 9 months to a year before you will feel more normal. Our goal in physical therapy with a rotator cuff rehab is to get you to about 80, maybe if we're lucky, 90%. So we're trying to restore full motion, and then we're rebuilding that strength. Here's the thing that most people don't realize when it comes to rotator cuff rehab, is the first few weeks after surgery, they're rough. I spent some time and I wrote down 10 things you need to know before having shoulder surgery. We will make sure to share this text in the post on YouTube, but I want to go through some of these things because if nobody has told you this stuff, this is the stuff you need to know beforehand. And we're not talking about what the surgery looks like. We're not talking about insurance. We're not talking about those kind of things. We are talking about the commitment and the tips and the things you need to know before surgery. So the first thing is it's going to hurt. Don't let anybody tell you otherwise that it's not going to hurt. Now, on occasion, we do get somebody who comes in and they don't have any pain. That in some ways can almost be a detriment because when you are, after you have surgery, that shoulder needs to be dependent, meaning you're going to need to wear that sling. The sling, here's another point for you, is not a suggestion. That sling is designed to be there to allow you to unweight that arm. Rotator cuff surgery, as I have seen images, I haven't done surgery, is it looks very frayed. It is not like a clean cut. It's not take your shirt, take scissors. That's not what your rotator cuff tear looks like. Most of the time, and it depends on if it's a little one all the way up to a massive to a complete tear, it often looks like a rope that's been rubbing around the corner of something metal and it gets very frayed. So what the surgeons do is they bring those things back together and they sew that up. But because this muscle is a contractile structure, something that comes together and needs to contract and relax, it has to be on vacation and rest for 6 weeks. So the objective is that you need to rest it for a long time. So that's where the sling is super important. And again, depending on what kind of surgery you have, you may be out to the side a little bit more, which allows that muscle to be on slack. If we see those slings with a big giant wedge right there, sometimes it's just a dependent sling. So whatever you're recommended to do by your surgeon, do it. Tip number 3, ice is your friend. A lot of people don't always like ice. I think people prefer a hot tub over an ice bath. However, when you have surgery in here, there is a lot of inflammation. And yes, you're taking meds and you're doing all those kind of things. We'll get to that point here in just a minute. But the ice provides local pain relief and it slows down the inflammation. The more inflammation there is in a joint, which doesn't always look like visible swelling, but swelling inside of the joint makes things more painful, makes the joint more crowded. So ice, ice, ice. Fourth tip, something that you need to know before having surgery, sleep is going to be difficult. We've heard this time and time and time again. Don't expect to sleep in your bed for a week, maybe 2, maybe 3, depends on the individual. Most people we find after surgery cannot lay flat on their back, even with the pillow. Most of the time they want that shoulder slightly forward and in. And so even if we have a client lay on their back so we need to do some work, we're often supporting them with a towel or a pillow because laying flat is just too much pressure on that shoulder. So what clients will tell us is they're often sleeping in the recliner. We should note that if you have a history of some neck issues or some back issues and that recliner is not comfortable, you need to be prepared that this is going to be just part of the healing process. Sleep is so important. I can't emphasize that enough. But know that your sleep is going to be interrupted, going to be difficult, and don't expect to get back to your bed for at least a week or 2. 5th tip. This is one of my favorite ones. Don't be a hero. Take your medicine. We see this with all kinds of surgeries, whether we're talking about joint replacement of the knee or hip or the rotator cuff. And we hear that because a lot of you, which I'm of the same mindset, don't like to take medicine, don't like to take pills. Well, that is all good because we don't want long-term dependence on pain meds or anything else. However, when you have massive surgery and they've been poking and prodding and sewing and stitching and doing all that kind of stuff to allow that muscle to work again, you've got to keep your pain under control. And that's where don't get off your cycle. I can't tell you what to do, what not to do, but I can tell you what I have seen with clients. Work with your surgeon. Make sure that you have a good pain management plan in place. Make sure you know how often to take those meds and stick with it. The people who end up off their schedule and start delaying too soon, it can take, I've seen it recently with a knee replacement, it took them almost a week to get back managing their pain so we could actually do some form of therapy. When you get behind on managing that pain, when you become in a lot of pain, just taking that pill isn't going to calm it back down. So work with your surgeon, work with your doctor, the nurse, whoever you need to talk to, make sure you're sticking with that initially. We can start talking about how you wean that off. You can work with your surgeon on those kind of things, but you just had massive surgery and eventually you will work off of it. You'll be able to use more ice than pain meds. There is a progression to this, but don't be a hero. Take your meds as directed. Number 6, and this is something, again, to know before shoulder. I always want to say shoulder. Shoulder. Wow, that's a tongue twister. Something else you need to know before having shoulder surgery is where are you going to do your rehab afterwards? Many times, the orthopedic clinics in your town will give you a list of all these options. You should be researching that long before you go into surgery. Do your research. Now, of course, if you live in West Michigan, you're going to come to Nephew Physical Therapy. But we don't have to just tell you that. You can listen to what our patients say, which is why you should be going to Google. You should be reading the reviews. Whatever part of the country you live in, people are leaving reviews. Now, of course, you're going to get 1 or 2 bad ones, and you're always going to get an unhappy customer everywhere you go. But see what the trend is. Look for multiple comments. Read through the ones that just aren't all happy and and squishy, right? Make sure that they've got some substance to them. If the patients or the clients are talking about what their rehab experience was like, do your research ahead of time. Know where you're going to go. Even feel free to reach out to them. Meet some of the therapists. We've done that before. You could take a tour of the facility, meet the team, do all those things ahead of time so that whenever the doctor says you are free to start therapy, which depending again on whether it's a small minor tear or a major tear, could be anywhere from 2 weeks to 6 weeks after surgery, traditionally. So you don't often start therapy right away, but when you're ready to go and you've already connected with them and have all your information, you don't have to go in there and worry about those things. Tip number 7, things to know before having shoulder surgery. This is going to take time. I already mentioned this. You are going to be in therapy for a few months. And you're going to need to take time, not to just attend your appointments, but to do your exercises, to ice, to do range of motion, to do whatever you need to do to rehab that shoulder. We've talked about this a few different times in some of our short form videos where your body isn't really, it's an investment. It's not an expense. And you just spent a bunch of money, you just spent a lot of energy, and you just incurred a bunch of pain, physical pain, to go through the surgery. Don't waste all of that effort and energy. You need to be committed to making sure that you bring that shoulder back to its fullest capabilities. And that's where it is a long haul. It is a commitment because we see people all the time who want to go bow hunting again, who want to ride bikes, who want to golf, who want to pick up their kids, go back to work. The list is limitless on how many things people want to do. And those things do not just happen overnight. They don't happen in the first 6 weeks. We start considering that stuff sometimes 12 weeks later, depending again on what the weight restrictions are, depends on how severe the tear is, what the surgeon saw when they went in there, how many additional structures needed to have some surgical help. All of those things play into it. So remember, having rotator cuff surgery is a big commitment in time, which, if I can add right here, is why you should be doing therapy long before it turns into this. Okay? Tip number 8, make physical therapy your top priority. All right, I'm actually just going to read this to you because I really like how this sounds. And I mentioned some of this already earlier. Buying a new car is exciting and it smells good and it looks good. Heck, you look good driving in it. We all know that signing on the dotted line is not where your responsibility as a car owner ends. Maintenance and regular oil changes are essential to keep your car running smoothly. And this is what PT is to surgery. The amazing surgeon has repaired, sewn, fixed, and screwed your shoulder back to normal. But without great physical therapy care after surgery, the shoulder will not likely work normally again. Make attending your appointments regularly on time and doing your homework as directed the most important thing of your schedule. This will help you get the most out of your shiny new shoulder. Make physical therapy your top priority. Oh, I like this one. Tip number 9. We're almost there, friends. Tip number 9 of things you need to know before having shoulder surgery. Don't plan on doing a lot of traveling for 3 months. You may not have thought about this. I can't tell you how many people I have seen over the years who have a massive surgery, and in the middle of it, they scheduled a trip to Florida or Europe or hiking or something that they're going to be a shopping trip, things that are going to require them to be on their feet for long periods of time. And you may think this is just my shoulder. Yes, but we already talked about the fact that you may not be sleeping well. You may need to be icing. Your shoulder, as it's hanging there, will get tired and will need rest. If you commit to doing rotator cuff surgery, commit to staying home for at least 3 months so that you can get it fully recovered, fully rehabbed, and then you can start considering taking some time off. But as we already mentioned, making physical therapy your top priority means that you don't want to miss any of your appointments because you're going to have highs and lows. You're going to have setbacks. You're going to have days where you feel better and days you feel worse. It is a normal part of the process. So keep that in mind. And lastly, my favorite tip of all is listen to your surgeon and your physical therapist. We're working with you. It is not our goal to make you feel worse. It is not our goal to yell at you. We don't even want to have come to Jesus moments if we can avoid them. That is why physical therapy and working with your surgeon and the doctor who is, of course, managing all your pains and all that stuff, if that's the same person, we want to make sure that that shoulder comes back fully and completely. And so that's where what we often describe as we review some of the expectations on the initial appointment and therapy is that this is a relationship. Physical therapy, working with clients, is a back and forth. We're going to teach you things. We're going to move you. We're going to do manual therapy. We're going to do all the things that we need to do on our end. But on your end, you have to actually go home and try it and do it and then come back and tell us, well, that was horrible. That worked great. I felt worse here. I felt better here. We did this. We adjust that. One of our least favorite calls is a cancellation call, especially when the client says, I'm in too much pain today to come to therapy. Remember our motto, pain is not normal? If you are in more pain in between appointments in therapy or on the day of therapy, go to therapy. We make changes to your program every single day you come in. You just may not know it. We are watching how you are moving and what your face looks like. And if you're excited or you're worried or you're wondering why you're even here, we need that back and forth, going back and forth. You giving us information, us watching the quality of the motion, putting our hands on you, which is, of course, the hardest thing. I cannot reach out and touch anyone through this computer. And so the more we can work face-to-face, work together, we're one of the highest touch industries for a reason, which is why COVID is so hard. I'm just going to put it out there because as a physical therapist, I want to see your face. I want to watch your facial expressions. I want to see if I can watch your face to tell if you're getting the exercise or not. I've been doing this long enough to know if you're frustrated, if you're excited, if it's connecting in your brain and you're starting to see why you're doing the exercise. Because again, If you are doing any exercise and therapy, you better know why. Therapists, if you're watching this, make sure your clients know why they're doing the exercise, because if they don't, they won't do it. I can tell you. But very much is a relationship. And so no matter if we're talking about shoulder prevention on the beginning side of preventing rotator cuff surgery, of getting rid of that pain early, of allowing a life lived well without pain, or if we're talking after rotator cuff surgery, doing these things, yes, is a commitment, but it's an investment, not an expense. We want to make sure that those shoulders are working well. And we're telling you, if you don't have a shoulder that works well, you're noticing it now. You can't sleep on that side. You're going to reach overhead into a cupboard. You're avoiding that. You're asking somebody else to do that for you. I'm trying to think of all the other things. You're just avoiding the use of that arm in some capacity. So let us help you. Find a skilled physical therapist who not only will look at your shoulder, but possibly screen out if it's coming from your neck. Don't forget that. They're holding hands here. Okay, they're working together. So we love treating shoulders, and as we've said, it's a wonderful complex joint. It is very much related to posture. If you need help with any of these things, please call our office. Did you know you don't need a referral? Did you know that we accept your insurance and we can figure that out? Anyway, I wanted to throw that out there today. Thank you so much for joining us, because your health, your body, you get one of those, take good care of it, because pain is not normal. Till next time.